TTP, blood clots are formed in almost all organs. The problem is a defect in a blood enzyme called ADAMTS13, which works like a scissor. Because the scissor doesn't work, it cannot cleave the very sticky and large protein von Willebrand factor. Therefore, this very sticky protein can spontaneously bind platelets and blood clots are formed. When TTP patients are treated, their plasma that contains the defective scissor has to be replaced by the plasma of a healthy donor. Since a patient has about 4 liters of plasma, we need 13 to 16 plasma donor bags to treat the patients. So it is clear that a lot of plasma is needed when we want to save the life of a TTP patient. The patient community is very important to bring the patients together and to create awareness for the ultra-rare disease TTP. The TTP community in Belgium does not only bring together the patients, but also the clinicians, the researchers and members of the industry. In that way, we have all key players together who want to improve the quality of life of TTP patients. Although plasma exchange is a very good treatment for TTP, it is a very challenging treatment because the patients have to stay for weeks or months in the hospital. So therefore, many research groups are looking for better treatment strategies that are much milder for the patient. Also, novel diagnostic assays are important because still 10 to 20% of the TTP patients are misdiagnosed and die because of that. And we also cannot predict when a TTP patient will have a new TTP attack. We are developing a diagnostic test for TTP that can be done at home like a pregnancy test. In that way, the patient can follow his or her activity of the scissor. When the activity is too low, the patient will know that he or she has to go to the hospital to be treated. In that way, we hope to better prevent a second TTP attack. We aim at commercializing this assay within 5 years.